How's Max doing? We're still in a practice session, looks like.
I think so, yes.
You ready?
Okay. Hi, everyone. Welcome to the debut of CB8 Zooms. My name is Lori Boris. I am a member of CB8, and we are delighted to be joined by New York City Councilman Mark Levine, who's the chair of the council's health committee. Earlier in the pandemic, the Washington Post called him the Anthony Fauci of the New York City Council. Welcome, Mark.
Well, I'm never going to live that one down. Thank you so much, Lori. I'm honored to be here in the debut of this new series. Thank you so much for having me.
Thank you. A bit later, we're going to take your questions about COVID. And if you want to ask Mark a question, you can put it in the Q&A at the bottom of your screen, and we'll try to take as many of your questions as possible. So think of your COVID questions that you want to ask Mark and put them in the Q&A at the bottom of the screen. So I want to start by thanking you, Mark, for protecting me from COVID as well as the rest of the city. In the early days of the pandemic, when really none of us knew what was going on, and I was frantically trying to learn how and where to get tested, and then later how and where to get a vaccine. And then because I'm a mother, where my adult children could get a vaccine, could go for the same things. But I learned so much from your office, your emails, your tweets, your webinars, etc. At one point, my son said to me, "Mom, you're the only person who knows all of this stuff. What's your source?" And I said, Mark Levine. So thank you for the information and for making me a hero to my children, which doesn't happen too often.
Wow. Thank you for those kind words and that kind introduction. It means a lot. And I have valued your friendship and your leadership, and happy to have the conversation today. I see we've been joined by the esteemed chair of CB8. Hey, Russell.
Hey, how are you?
Great to see you too.
Good to see you too. And I just want to break in here briefly to say thank you very much for being here and helping us to inaugurate this series. And I also want to thank Lori for all of her hard work in putting this together. So I just wanted to briefly add my own thanks to both of you for putting this all together.
Okay, thank you. So let's talk about today, okay? Today is September 27th, and it's a significant day for many reasons. Honestly, I think that we've been getting whiplash because it seems that the rules change, by the hour. So until 2 days ago, today was supposed to be the day that all New York City employees had to show proof of having received at least one of the vaccines. And then a judge late on Friday granted a temporary injunction. I'm not a lawyer, but this seems to throw a wrench in the works. So Mark, what is the latest? What is really going on?
Well, thank you again, Laura. If it's okay, I'll just offer a little bit of a big picture on where we are in the pandemic and
Sure.
talk about why vaccine mandates are so important. And then in what's happening today, it's kind of a fast-moving situation. But we can feel great about the progress the city has made in vaccination, with now 75% of the adult population vaccinated. It's really an extraordinary achievement. And it's why we have not endured the kind of brutal summer wave that we saw in the South, and which is now hitting really hard in places like Appalachia and some of the upper Midwest. It's a lot to congratulate New Yorkers about, who've done the hard work to get us here. But I don't want to minimize the extent to which this pandemic is still very much an ongoing threat in the city. We've had a slight drop off the summer peak when we were at 1,950 or so average cases a day. Now we're at about 1,750. So moving in the right direction, but notably not the kind of steep drop that we saw, for example, after our horrible spring peak of 2020. So, and by any measure, the fall represents risk for us as the temperature gets cooler and people go back inside. And, we've lived our life outside this summer. New Yorkers, we've been going to, our birthday parties have been outside, yoga classes are outside. entertainment, concert shows outside, and all of that's going to change in the fall. And so, experts I talk to are worried that we could face another wave in the fall. I say could because I think nobody's making predictions anymore. This has been such an unpredictable pandemic, but the risk is real. And it's why we have to continue to push on vaccination. It's really the best tool that we have. And it particularly in sensitive contexts like healthcare, hospitals, nursing homes, schools, where there are vulnerable people in close quarters, whether they are patients in a hospital, seniors in a nursing home, kids in a school. And it's why in those environments there has been mandates offered at this point from the city, state, and federal level at varying degrees. Just one clarification on a point you said earlier. The full mandate is only in place for those sectors that I mentioned. For the broader city workforce, it's a test or vaccinate mandate. So people who are at the housing department, Department of Housing Preservation, for example, can either get a weekly test or get a vaccine, which is a pretty big difference from a straight up vaccine mandate. But as of today, there is a mandate in place in healthcare. There's a lawsuit pending statewide, but it's only impacting people who have a request for a religious exemption pending, not for the broader mandate. So again, as of today, people in healthcare and nursing homes in New York State have to be vaccinated. And in the context of our wonderful public hospitals, 5,000 members of the staff have not met that standard and are not able to come into work today. They're going off payroll. And I know folks are worried, oh my gosh, how's that going to impact the operations of our public hospitals? That seems like a lot of people. And I had to say that my reports so far today are that operations are going pretty well in our public hospitals, partly because they've been able to plan for this. And so they've surged staff in some shortage areas, partly because a lot of the unvaccinated staff, or not all of it, are in clinical positions. They could be in housekeeping, et cetera, which of course is very important, but it doesn't disrupt the medical procedures. Perhaps if it goes on too long, it will become more of a challenge. But for now, the hospitals are doing okay. And it's just a testament yet again to the healthcare heroes. This is one more challenge in addition to the health crisis. Now they have to deal with having fewer of their colleagues there. And those that have done the right thing are now having to pick up the slack in the medical context. As for schools, the lawsuit actually stopped the mandate, but probably only for a couple of days. There's a hearing, I think, on Wednesday in front of a three-judge panel, and most people seem to expect that the mandate will go back into effect on Wednesday. So a little bit of a disruption here in the early part of the week. But in all these contexts, it's so important that staff are protected first and foremost with the vaccine, and that their families are protected. We don't want them bringing the virus home, but also that patients and kids and seniors are protected. And so I'm really hopeful that the courts will allow the school mandate to go forward. There are concerns there too about staffing shortages. I'm told that over the weekend, there was something of a rush to get more vaccinations among school staff, which is really great to hear.
Good, yeah.
And maybe there will be today and tomorrow. They have a couple extra days because of the court. And I know there's a lot of substitutes on call. So I'm hopeful they'll be able to pull it off. The chancellor has said that, Chancellor Porter has said that they can continue school functioning even with the loss of staff. And I'm also hopeful that, there's staff out there who have been doubtful about this vaccine. And I get it. There's people who have just had questions and anxieties, and some of it is driven by misinformation and social media. But also we have to acknowledge that there's a long history of racism and neglect in the American medical system, and that's impacting people's trust of the vaccine. And I get it. And I've talked to folks who have said, when it came down to it and my job was on the line, I really just took one more chance to ask tough questions, and I got enough answers that I was comfortable getting the shot. And that's really what we want. And anecdotally, that is happening at least some. And I'm hoping we'll see even more of it in the coming days.
Okay, well, that's really good. I'm hopeful about that. I was going to ask you a question about there is someone in my building. There's someone who lives in my building who refuses to get vaccinated. And I've been trying, in my not so subtle way to ask him the questions that I've been told to ask, to encourage people to do this. And I said, what about your parents? And he said, oh, my parents are vaccinated. What about your nieces and nephews? He said, oh, I don't see them very often. And then finally I got to, I think that money is the greatest incentive of all. And I said, how about the $100? You can get $100 if you get a vaccine. And he said, I don't need $100. I said, who says that? So do you think that there's anything else that we can do? I mean, I feel like, the city has done really everything that they could think of, including giving money. Is there anything else that we can do to persuade these, resistant people?
Each of these strategies is important. Definitely incentives for some people make a difference. I don't think that they are massive game changes. I think that someone who has held out at this point, 8, 9 months, probably it's not a question of free concert tickets that's going to move them. But there are some folks on the margins, and so I'm all for having that tool on the table. I think that the screening at restaurants and gyms and movie theaters, again, for some people has been decisive. There's people who I've talked to who were not adamantly opposed, but just didn't feel moved to do it and didn't want to deal with the hassle. And well, they want to go to the movie theater. So that was the one thing that kind of pushed them. And I've talked to folks whose jobs are on the line, who felt that was going to be the deciding factor. They finally decided to do it. But I think we still need to have patient and respectful dialogue with people, not accusing, not judging, not name calling, but saying, hey, we get it. You have doubts, you have questions, and we'd love to hear about it. And it's best done with peers, with stakeholders who have real credibility in the relevant communities. So physicians and medical professionals who are rooted in communities of color and immigrant communities are uniquely positioned. Faith leaders of all backgrounds, uniquely positioned. And people who talk to their loved ones, their family members, and just talk about their journey to getting the vaccine and their experience since. I don't know how close you are to your neighbor, but I presume it's not the same as if what you were talking to your sister-in-law.
Yeah, exactly.
Or someone who you had a more intimate relationship with, and saying, look, here's how I decided to do it. I had concern, but then I talked to, my best friend, and she got it. And so here I am. Medical professionals, I think, are ultimately the most effective. And one of the first things I say to someone who's hesitant is, have you talked to your doctor about it? For parents, have you talked to the pediatrician about it? Mm. And it's surprising how many people say the answer is no. Every medical professional is going to advise their patients to get it.
Right.
There's a myth out there that there's all these medical conditions that would lead a doctor to say, don't get the vaccine. It's just not true. Right. Really, the only medical condition that would lead a doctor to tell you maybe not to get the vaccine is if you have an allergy to one of the components of the vaccine. And that applies to approximately between 2 and 5 people per million of the population. And even for those individuals, there are workarounds. There's the ways that doctors can work with you so you still get the vaccine. So, virtually no doctor is telling you not to get the vaccine. So doctors, should be calling their patients. If you haven't seen someone for a physical in the last 9 months, you should be calling them and say, hey, have you got the vaccine? Can I answer any questions? Let's talk about it. Maybe you could come in. We can talk face to face. I can offer the vaccine in my office. The more that happens, the better.
Okay, thank you. There was a report about how last year there was no flu outbreak, or next to none of a flu outbreak, because everybody was wearing masks. So do we need to get a flu shot this year?
Yes, we do, because there's a real fear that you'd have what some people call a codemic, where we could have more than one respiratory disease hitting at once. And in the worst case, that's going to break the medical system, because it's all the same resources that you need to treat someone with severe pneumonia, or severe flu, or severe COVID.
Right.
And there's some public health experts who are starting to say some of the precautions that we have taken during the pandemic, we might want to start bringing back seasonally as appropriate, such as masking in crowded places, or maybe on the subway, masking year round, and other venues where we're in tight quarters with people. Some people did that pre-pandemic, and honestly, they were ridiculed. And I think those people have been vindicated. And so it's possible that once we get beyond COVID, that we start to incorporate some of these routines, not the severe stuff, closing restaurants. I'm not talking about that, but some of the more reasonable precautions. But in the meantime, Lori, everyone should get their flu shot. Now's the time. Flu season is just starting. And so you're definitely not too late. You're still on the early side, but get your flu shot, please.
Okay, thank you. So we know that masks are required on the subway, and most riders I find are compliant, which is great. But what about that one person or two people who are not wearing a mask? Can anything be done? Is there a concern about enforcement? I read something about the MTA was going to try and enforce masking a little bit more. How is that going to work?
I mean, masking is still really important. And we've been talking about vaccines. Number one tool. Arguably, it's our number one, number two, and number three tool. But vaccines are not enough. It's just not enough with Delta, because there's people who are not vaccinated yet because they can't get vaccinated because they're under 12. The people who are immunocompromised, and the vaccines don't give them a lot of immunity. But someone who's got the vaccine can also catch the virus, as we know. They're much, much less likely to. And if they do, they're much less likely to get hospitalized, with all those caveats. But masking is still important in crowded indoor settings where you're not sure that everyone there is vaccinated. So obviously a subway where the rule is that you must wear a mask. To my regret, that rule is not in place in a supermarket or a pharmacy or a deli. And I've been pushing very hard for the mayor or the governor to impose a mask requirement for those venues. Retail, when you go to, Best Buy or whatever, there's currently no mask mandate. There should be. In the meantime, folks, please wear your mask in those venues. But as for the subway, masking works best when it's kind of like, a solidarity social contract, and everyone's doing it, so everyone else does it, and you want to just kind of be part of the crowd. And I think that has mostly worked on the subway, but it's not 100%, and it should be better. There's been virtually no enforcement. In fact, some reporter asked at a press conference, how many tickets did you write this summer for lack of masks? And I think the answer was zero. And so they've announced, because of that journalist's inquiry, that they're going to start ticketing again. I'm a little wary about overly excessive enforcement and about some of the pitfalls of enforcement that tend to hit young people of color unfairly. So I would prefer that people do this out of solidarity, but at least warnings and reminders, from officials. What they did in the early days, which I thought was very good, is they would hand you a mask. And hey, young man, I see you don't have a mask. Here's a mask. Please put it on. And that worked for most people. So I do think we need to push a little bit more, but hopefully avoiding a kind of overly aggressive response.
Yeah. Okay. So there was word recently that the Pfizer vaccine was shown effective in children from ages 5 to 11. And so that led to speculation that we could have it approved by as early as October, which I think would be great. But do you think that there'll be a rush for the vaccine, or do you think that we'll have to convince people that this is, the best way for them to protect their children?
This is a question which we're not talking enough about. Because we all remember those days in January, February, March, where it was like the Hunger Games to get a shot. And so we're just assuming that as soon as vaccines become available, that will happen again. But it has not happened for the 12 to 17 cohort. We're now at, I don't know the latest number. I think we're at 60% fully vaccinated or close to that. But, it's taken us a long time to get there. And something that is a little bit of a red flag to me, which I haven't seen reported on, boosters have been available for people with immunocompromise for, I think now, like a couple months or like at least 6 weeks. And there's not been much of a rush on that. So, and I actually haven't gotten the numbers since Friday, but I haven't heard that there's been a huge rush for boosters now that it's been dramatically expanded. And, folks who are eligible should get that booster because, look, these are always going to be 3-dose vaccines. That's very common with vaccines. There's some evidence of the waning benefit of the vaccine over time. So everyone's got to get the booster. And of course, for younger kids, they got to get their first shot or first 2 shots if it's an mRNA vaccine. And there's an interesting phenomena of parents who had no problem getting the vaccine, or at least who have gotten the vaccine, but are a little hesitant for the kids. It's a very interesting phenomena. And we've already seen that happening with the teenager cohort. And I fear it's going to happen more with the elementary school age cohort. My response to that, based on what I said a few minutes ago, is talk to your pediatrician.
Yeah. I spoke to my doctor. I'm sorry, go ahead.
Please, no, please.
No, I was going to say that I have an immune disease, and I went to my doctor and I said, should I, and this was when it was first released. And I said, should I get a booster? And he was talking about, well, we can test your blood for this and we can test your blood for that. And I was like, he said, look, everyone's going to have to get a booster eventually. So he said, I would recommend that you get it. Yeah. So I just went, and it wasn't difficult at all. I went to my local pharmacy and I got it right there. And my partner came with me and he's over 65. So he got it as well. And there was no,
So we should remind people that now, if you're over 65, you can get a booster. If you've had Pfizer, we'll talk about Moderna and J&J in a second. Right. If you have an underlying condition, and remember back in the day, we made people with underlying conditions eligible for those first shots. It's the same category of conditions. Yes. I happened to tweet it out, but you might remember from the spring, it's a pretty large collection of medical conditions. But there's also another category, which is people whose jobs put them at high risk. So if you're working in healthcare, even if you're not over 65 and don't have an underlying medical condition, you can get your booster. If you're a teacher, if you work in a pharmacy, if you are in, if you're a first responder, and I think there might be one other category, but it's a lot of people. It's actually most of the population can now get their booster. Any city-run medical vaccine site, you can do it. You can make an appointment. You can go for walk-in. It's very easy.
Okay, it looks like we have a few questions. So I want to try and address some of those. This is from a member of the board, focusing on returning to school, especially critical in pre-K and primary grades where remote learning does not work so well. Your observations and suggestions to make for a smooth transition in our schools, especially in the early grades, including safe spacing, ventilation, masks, and vaccines.
This is huge. Can I just answer a question that would be super quick from Mike Shatskin? Sorry.
Sure. Oh, sure.
Just because we can just knock that one out.
Okay.
Mike's asking about getting a third shot if you have Moderna. Now, if by chance the patient has an immunocompromise, you can already get a third shot of Moderna. I just want to put that out there. For the rest of everyone, that is expected very soon. I think like in the next couple of weeks. And that leads to the next question about J&J, Johnson & Johnson. I had Johnson & Johnson. Provides very good protection, but very frustrating that there's no news on a booster there. That's probably a little bit farther down the line, but I'm pretty sure in a matter of weeks, maybe not 2 weeks like Moderna, but in a matter of weeks. So I think Moderna, it'll be like 2-3 weeks. But as for board member Peter Patch's excellent question about the schools, wow. We could do a whole panel on this. Very quickly, the pillars of protection in schools are ventilation, vaccination, mask wearing, social distancing, quarantining as appropriate, and testing. And I have varying levels of confidence of where we are on those things in with regards to the schools and the DOE plan. And some of them, I think we're in good shape. I am really concerned about the amount of testing. I feel like we have to go much, much bigger, both in the amount of regular testing of the school community. For comparison, Los Angeles is testing the whole school community, teachers and students weekly, and it's a PCR test weekly. In New York City, it's only 10% weekly. It doesn't include staff. It doesn't include vaccinated kids. And it's only people who opt in for the test.
Yeah, is that enough?
No, it's not. I mean, public health people want, the gold standard would be weekly. But there's a whole nother world of testing, which are these instant antigen tests. It's kind of like a pregnancy test. You get a result in 15 minutes. You can do them yourself. You can do them at home. We're not making use of those. The city as a whole needs to be making much better of use of those. You should be able to get them for free or low cost everywhere. In Japan, you can get them in vending machines. In Europe, you can get them in supermarkets. In the UK, they'll mail a pack of 7 to you for free. It's great. We should have that here. But in the context of the schools, if there's a case in a classroom, send every kid in the classroom home with a pack of 7 self-tests and tell them you can come to class every single day as long as you get a negative test in the morning. We're not doing that. So I would like to see us do much better on testing. I don't know if Peter has a follow-up, but that's a little bit on the school context.
Okay, thank you. The schools are asking you to self-certify, from what I understand, right? You have to hand in a piece of paper that says you're okay and you haven't been exposed to anybody with COVID. I mean, if they're going to do that, why not do the testing, as you said?
Yeah, I mean, this self-certification thing, it has created a huge logistical bottleneck. I just don't know if it's having any impact.
Yeah.
I just think that most people at this point, they're just clicking on whatever they have to click through to get it done. I guess I'd like to know, are you actually catching anybody who has like been exposed through that? I don't know. I'm kind of doubtful.
Okay, here's another question. Can a person who got their original shots from Moderna, can they get a booster from Pfizer?
So I think the answer would have to be only with doctor guidance at this point. Anyone who has had either Moderna or Johnson & Johnson, or if you've had Pfizer and you're not in an eligible category, but you have reason to believe that you're vulnerable, should talk to a doctor, and your doctor can get you a booster. This has been true for months. If you feel that you are vulnerable in some way and you need the booster, I would talk to your doctor immediately. But for run-of-the-mill public who's just going on their own, the only category that can go Moderna now is immunocompromised. There's a related question is, do I have to go back to the same place I got my original shot to get my booster? The answer is no. So don't worry about that. But for now, you need to get the same brand. There's research. There's some people who say there's advantages of mixing and matching, even going from J&J to one of the MRAs, but that's not official policy yet. Maybe it will be.
I must have gotten really lucky, I have to say, because I had a Moderna and I got the booster just like that. And it wasn't a problem. Just the local pharmacy, did it. And I had to assert that I have, an immunocompromised,
All
system.
of it is all of it's by self-attestation.
Yeah.
Okay.
All right. So let's go to another question. This is very good. Margaret is asking, how much immunity, if any, does an unvaccinated COVID survivor person have? Because they have antibodies. And what do the antibody numbers mean? Should they still mask indoors and vaccinated person asking for a friend? So I think the question is, if you had COVID, are you okay? Do you have to get a vaccine?
The answer is yes. It is also true that recovering from COVID, I recovered from COVID, thank God. My family did. You do have, it appears that you have very, very significant immunity, but several important caveats. First of all, it's unclear whether when that immunity wanes. I got COVID in March, April of 2020. So, we're talking, what is that, 17 months at this point? So, science doesn't have a good answer about whether the immunity I got from recovering from COVID is lasting 17 months. Secondly, there's some lack of certainty about whether as new variants emerge, the immunity, I got COVID back when it was the plain vanilla, original recipe, so to speak, of SARS-CoV-2. And science is a little unsure about whether that is rock solid against the various alpha, delta, et cetera. But here's another thing that's really important. Getting a vaccine on top of having the benefit of recovering is even better. So there's just no doubt that you're better off getting the vaccine whether or not you have recovered from COVID. So really everyone should get it. And because there is, this is such a phenomenally safe vaccine compared to aspirin in the level of safety. And the benefits are so massive, everyone should get it, whether or not you've recovered from COVID or not. Acknowledging the benefits of recovery as I just did.
Okay, sounds great. Can I ask another question that that comes from me actually is, most, if not all of us live in apartments. And I hope it's not too much to assume that all the supers have been vaccinated, although I guess you should ask. But if an outside, what if an outside contractor comes in to fix a leak or, paint a wall? Do we have the right to demand that they be vaccinated before we let them in our apartments?
Well, I don't know if you have a legal right. I don't know the answer to that.
Okay. Well, you can ask around and come back for another show.
Yeah. I mean, if someone was going to be in my apartment while I'm there for an extended period, I would definitely want them to be vaccinated.
Yeah.
Because enclosed spaces, et cetera. I guess if I was not home when the work is being done, a little bit different. But certainly if I was going to be home while someone was working in my apartment, I would want them vaccinated. I assume it's in your legal right, but I'll have to confirm that for you.
Okay. Restaurants and small businesses have really suffered through this pandemic. And with the rules currently in place, can we feel safe going out to for dinner or going out to pick up something from the supermarket or the hardware store? Can we feel safe?
Yes, I think while acknowledging that the virus is still out there, I don't think people need to live in fear right now. Because New York City is screening for vaccination in those settings, and that's really a game change. People, if you have reason to believe you're vulnerable to COVID, even having been vaccinated because of medical condition, you do have outdoor dining as an option. You might want to avoid very crowded indoor settings if you're immunocompromised, et cetera. But that's a decision I would make in consultation with your doctor. But someone who's vaccinated and masked, even in an indoor setting, I think it's fair to say is at pretty low risk, particularly in a place like a supermarket where you're not crowded shoulder to shoulder with people for extended periods of time. But risk is a very personal thing, and the amount of risk that you are comfortable with is a deeply personal question. But I don't think people should live in fear, and I want New Yorkers to live and enjoy this amazing city and go to museums and enjoy a night out with friends. And I really believe that given that we're screening for vaccination and that you can wear your mask in those settings, that it's something that most people should feel comfortable doing.
Yeah, it's really hard though. It's really hard because I want to feel positive, but then there's, it trickles into my brain that, maybe it's not safe. But I have to say that I have experienced in the last week or so the thrill of, I went to a Broadway show, and there are new venues that are coming back from like there was a candlelight Bach to Beethoven concert by a string quartet, and everybody had to be masked and everybody had to be vaccinated, but it was wonderful. It was like this magical thing that I had never experienced before, and I was like, okay, it's going to get better.
Yeah, I got to go to the dress rehearsal of Hamilton a week ago.
Yeah.
And it was very intensely screened for vaccination, and you had to have your mask on the whole time. So I felt safe. But to be there for live theater, I'm sorry.
Right, nothing like it.
Netflix is not the same. I'm sorry.
Yeah.
It's really not.
That's true. Let's go to another question. This is from another board member, Kaz. Why are restaurants required to do the inspector's job? Why not have inspectors find the individual who is unvaccinated inside a restaurant? And why are restaurant staff not on the booster recipients?
Those are both very good questions. Look, I think restaurant staff should be on the booster recipient list. The question of employee groups being eligible became very controversial because there's not real research on it. And some of you probably read that Dr. Rochelle Walensky, who's the director of the CDC, actually had to overrule the panel that set the rules on the boosters, which most people applauded her for. But again, there was not exactly strong research on that. So a little bit of the backstory there, but I consider restaurant workers to be some of the heroes of the pandemic, and I would support them getting the booster if they want it. As for the enforcement, I think it's a good question. And we all saw those horrible videos of what happened at Carmine's in Times Square. And it's just not fair to make a restaurant host have to play that role. I think there's a resource question about whether we could have enough staff to cover tens of thousands of restaurants. not to mention movie theaters and gyms and all the other venues. But I am really sympathetic to how tough restaurant workers have it right now, and asking them to play police is really not fair.
Yeah. Whatever happened to us, applauding everyone at 7 o'clock? I mean, that was that was really like a daily booster. I enjoyed it a lot, and it just kind of faded
Sure.
away. But anyway, Julia is asking, says that testing seems to me to be the way to keep out or to keep us all healthy, and breakthroughs that are not being kept track of. Every member of a household could test before they leave the house every day, and this protects all ages and the vaxxed and unvaxxed. What do you think of that? Testing as opposed, I think she's asking testing as opposed to
I totally agree with Julia.
vaccine.
She's talking about the rapid home self-tests that are really good at detecting if you're contagious. And they should be everywhere and ubiquitous and free or low cost. You should be able to go to the library and pick up a pack. You should be able to buy them for incredibly cheap at supermarkets and pharmacies. Right now, they're $24 for a pack of 2, if you can find them at a pharmacy. And
Wow.
they're not easy to find because they're rarely in stock. Other countries are running circles around us. And I totally agree with Julia. We got to do much better.
Okay, and Amy Schwartz asks, what do you think of a bill by Senator Lieu and Assemblywoman Fernandez to require the DOE to provide remote learning for our families, and a possible executive order by the governor to require the DOE to offer remote learning?
Well, Senator Lewis and Assemblywoman Fernandez are great leaders and great friends. I haven't seen their bill, but I do support a remote option.
Yeah, do you think that it's going to come to that? Do you think that they'll eventually be, I mean, it feels like a week to week thing with if they have to close a certain number of classrooms, will that trip, I'm sorry.
Well, the mayor has said that he's adamantly against it. Actually, I don't really know where Governor Hochul stands on it. If God forbid there's a horrible COVID situation in the schools, and the number of outbreaks and the number of cases and the number of closures and quarantine spikes, that's probably going to change the mayor's calculus. I sure hope it doesn't come to that, though. But I do support that option, and I appreciate Amy raising the question.
Yeah.
And I apologize, Lori. I'm gonna have to leave in a couple of minutes. I know. How about if I promise to answer the questions very quickly, those that remain?
Okay, go ahead.
Well, you can feed them to me. What have we missed?
Oh, okay, all right. Well, there's a few. As an unvaccinated, no, that's just a comment. Sorry. What do you think of our governor saying that God wants us to vaccinate?
Oh boy, I don't know, Julia.
I mean, the whole thing about religious, if I could say something, the whole thing about a religious exemption, I mean, I don't know a single official religion who has a prohibition against vaccines, so I don't know.
And some people have cited Jehovah's Witnesses, but they actually put out a statement over the weekend saying that unambiguously that they do not prohibit vaccination. And in fact, 99% of the this is their statement, 99% of the 4,000 people who work for Jehovah's Witnesses in New York State are vaccinated. So just want to put that out there. So everyone should do it, but they should do it because it's the safe thing to do. It'll save your life. It'll save the life of people that you love. And ultimately that is the moral thing to do. I'm not going to invoke any religious precepts, but I certainly think it's the right thing to do.
Okay, well, I want to say thank you, Mark. I mean, you're such a wealth of information, and I actually agree with the Washington Post about you being the Anthony Fauci of the New York City Council. And so thank you so much for joining us for our debut webinar. And I guess that's it for CBA Zooms. And I just want to thank everybody so much for attending, and keep your eye on our website, cb8m.com, for future webinars. And we hope you'll join our mailing list. And I want to say thank you to Will Brightbill and Saida Harriman for the technical assistance. And my name is Lori Boris, and I wish you all a wonderful day.
Thank you,
Thanks
Lori.
again.
Thank you, Will. Thank you,
Thank
Zaid.
you, Mark.
Be well, everybody.
Bye.